Enrollment begins this Wednesday for insurance through the Affordable Care Act. And whether you're on the federal marketplace or covered through the employer or Medicaid, this year's enrollment is already impacting your costs.
And here's why. The Trump administration cut cost-sharing subsidies. Those helped lower-income people pay deductibles and co-pays. Since insurance companies are no longer receiving them, they are raising your premiums to make up for that loss. And even though Republicans didn't end Obamacare, they did cut 90% of the funding for outreach and marketing. KXAN's Phil Prazen shows us local groups who help people enroll are worried people don't know how to sign up.
Okay. Rafael Torres moves pretty slow today, but he'll be the first to say he's in better shape than he was this summer.
When he said cancer, I saw all my life passing in front of me, all my life.
Surgeons removed a tumor from his spine in August. He had health insurance through the Affordable Care Act. The nonprofit foundation communities helped him sign up.
If I need to say thank you, God, thanks God, to be with me in the worst moment. Thank you, the program of Obamacare.
Austin Congressman Lloyd Doggett says the program is hanging on by a thread.
But it will be there without doubt for this next year, and that's why everyone should enroll now. If they can point to the fact that their people are not interested in the Affordable Care Act, that will just be used to destroy it.
Elizabeth Colvin from Foundation Communities says they've doubled the amount of volunteer navigators from last year to 120. She says the Texas marketplace still has 4 insurance companies offering 33 different plans.
The Affordable Care Act is still the law. Financial help is still available.
At this point, the future of Obamacare might not be decided in Congress, but by the people who enroll after Wednesday. Phil Prazen, KXAN News.
Just 6% of Texans buy their own insurance through Obamacare. For some perspective, 49% of people in the state get insurance through an employer or a family member's job. More than 1 in 4 get it through Medicare and Medicaid, and a full 15% of Texans, more than 4 million people, still do not have health insurance at all.
We wanted to know how much a plan under the Affordable Care Act would cost a family in Austin. For a young family of 4 making $80,000 a year, we found prices between about $250 a month to nearly $1,400 a month. For a couple whose children are no longer on their plans, we found plans costing from about $1,200 a month to more than $2,700. In all of the plans we found, the out-of-pocket maximum, or the most you would pay in 1 year, is $14,700.